statistics of HIV and AIDS in India and Pakistan. About India, as India has the highest population in the world, it states the high prevalence of HIV and AIDS, the second largest country after the sub-Saharan countries in Africa. In India, there are 51% of the people AIDS-related deaths occur. Of them, only 36% of cases were treated. This report was given by the UN AIDS, which is United Nations of AIDS, reported in India. There are five states which have a high HIV prevalence. They are like Tamil Nadu, Andhra Pradesh, Karnataka, Mizoram, and Nagaland. As you notice here, there are the southern states of India are highly affected because there is a transgenders, which is known as third genders, popularly known as Aravanis or Hijras. The major income of them is through the sexual activities and users, and also like migrants and female sex workers has a high prevalence. So Indian government has taken some few steps to prevent and control the HIV and AIDS, like launching the programs and through mass communication and educating them, and revised strategy of migrants through their source and their destination and their transit, and also giving free first and second line of antiretroviral therapies and lifelong antiretroviral therapies to women for those affected with HIV. And now the total population of the total patients of HIV and AIDS are 2.4 million are affected in the India. And now I'll speak about the Kyrgyzstan. Like through Kyrgyzstan has a low prevalence of HIV and AIDS, but during the recent cases has increased. There is a rapid growth of HIV and AIDS in Kyrgyzstan due to the number of increased drug abusers. There is 30% of prevalence in Chui region, that is like which comes under Bishkek, Khan, Karabalta, and Tobruk. These regions has a high prevalence, and the second place goes to Osh region like Jalalabad and Osh city and surrounding places. The recent study which has been a meeting held in the Kyrgyzstan yesterday, like UN AIDS, United Nations of AIDS in Kyrgyzstan, US Ambassador Shevai Dvalpi has stated that the number of reported cases were high, so she has a ambitious goals like 90 and 90. Like 90% of the people should be diagnosed, and 90% of the diagnosed HIV patients should be treated, and the 90% of the diagnosed HIV people on the treatment, they should be virally suppressed. And my friends will continue this.
Etiology of the AIDS. Everyone knows about the etiology of the AIDS. What is the causative agent of the AIDS? HIV virus. HIV virus can be further divided into two categories, HIV-1 and HIV-2. Which is the most common agent of the HIV-1 and most infectious? HIV-1. On the basis of the nucleotide sequence, HIV-1 further divided into the subgroups. Number 1 is a clade E, number 2 is a clade B, number 3 is clade C. Clade B is mostly attack on the macrophages. Which cell which have a CD4 positive? Do you know?
Yes. Dendritic cells.
And
Langerhans cells.
microglial cells. Everyone know about the CD4 positive cells. It's a good. So the clade 1 is a mostly attack on the macrophages. Firstly attack on the macrophages because it's a CCR5 receptors. Its love to attack on the macrophages is spread by the anal cells. So it means the mostly clades be present on the homosexual persons. Clades its love to bind with the female genital tract, so transfer to the heterosexual activity mostly in the island, but clades is mostly present in the United States. Clades recently found that they are the most infectious. This is the most rapidly spread. It have words India. They are mostly present in the India, Pakistan, and Asian countries. So next is the Ronald.
Everybody. Yes, I want to talk about the transmission. Everybody knows, but it's our duty to remind people continuously. The transmission happens if the multiple sexual partner, if there has the intravenous drug addicted, it also transfer from mother to the child for the vertical transmission, and it also happens to the homosexual. It's the most, I think, dangerous cause. Is 70 to 80% of homosexuals. And also, it who has the suppressed immunity also can have the transmitted disease. And there's the report, we can say anal sex is the peak level it can transmit. And while kissing, it doesn't show any till not proof, but it can even spread by the deep kissing if you have already existing oral mucus lesions or it can be cut, so it can have transmission. So after transmission, how is misdiagnosed? We know that viral loading is very high in the early 2 to 3 months. When you are infected with the HIV virus, it can have maximum load 2 to 3 months and it can just show the symptoms. Just a symptom just like flu. You will have the sore throat, you will have the slight fever, you will have the malaise, you will have the anorexia, vomiting, abdominal cramps. So these are all kind of general symptoms which is mostly undiagnosed. And this is called acute HIV symptoms, and also we have clinical latent phase. Means in this condition the people will have the HIV virus in the body up to more than the 20 years also, but the average is 6 to 8 to 12 years. So in this condition they don't show any symptoms. This is also called asymptomatic phase. So at the last of this phase the people start to show symptoms, that is called AIDS. So in this condition till that years the immunity is fully suppressed. As my friend said, it attack on our CD4 T lymphocytes, the most policeman of the body. So if the policeman is damaged, so no one can help us. So it will show the symptoms, AIDS, CNS symptoms, convulsions, seizures, esophagus problem, abdominal cramps, opportunistic infections, cancer, TB, pneumonia, all kinds of symptoms will show. That's called AIDS. And we need to work in community. We need to work together. If we will work together, we can have more awareness programs. So we can have suppress the spread of the AIDS. So what is the advantage in the working in the community, working with the peoples, working with the social, with friends? First of all, it improves our talent. It improves our quality of education. It suppresses our anxiety up to 22%. It's a report of the WHO. It also improves us for the working to get job. It also improves us to work as a volunteers. So it's very, it's our duty to work as a group to spread the knowledge, to spread the awareness program to the street, to the uneducated people, to the villagers. So, and the prevention, we know we shouldn't have multiple sexual partners, we shouldn't have drug addicted, we shouldn't have contaminated syringes, we should have sex with the one sexual partner, we should use the condoms. So it's all the prevention, and rest of all I will say. Thank you.
Yeah, so girls, are you all aware that women are more vulnerable to HIV and AIDS? Yes, this is true. More than 60% of the people who are infected with AIDS are women. And studies shows that women are more infected than men do, and men can more easily transmit the virus than women do. The reason is because of the biological makeup of female genital tract. The reason is the vagina is more wider as compared to the penis, and after the sexual intercourse, the semen can stay in the vagina for longer time, whereas the penis will be exposed to the vaginal fluids only during sex. It means the semen can stay in the vagina for longer time. It means the more exposure to infected semen. So the transmission is more higher chances. And if there is any small cuts on the skin of vagina are hard to notice, but they may allow the HIV infection into the body. And gender sexuality and intimate partner violence is also one of the reasons. Here, most of us have come from the kind of society where the woman is supposed to be more loyal to the partner, even if the man is, even if the relationship is more violent. But men are encouraged to have extramarital sex, and the women are more fragile and more weak. They cannot say no to the sex, or they cannot insist the partner to wear the condom. So this is also one of the reasons, and because of the education, lack of awareness is also one of the reasons. And especially in India, we have more health access points, but very less women are able to access through that because of lack of awareness about the sexual health. And even if there is access also, the women, even if the women go, because of the judgmental barriers, because of the judgments of the healthcare professionals in that access points, are preventing or excluding the people not to go to the centers. And we, being the doctors, also we should be more encouraged. We should be more encouraging to the patients, because this is only not because of the root is not only because of sexual root. We have other roots also where innocent people are affected. And the only way that women can be protected from HIV is having a single sex partner, and the partner who is having sex with only one woman. And even being more careful with the syringes, we can prevent.
У нас сейчас лекция, они тут про сегодня же день по борьбе со СПИДом, они ходят вот так.
And there is also mother-to-child transmission through breastfeeding, through pregnancy and through labor. Fortunately, we have antiretroviral therapy in India and in many other countries also. If the mother or if the pregnant woman is treated in the proper time, we can reduce the chances of HIV transmission from mother to child.
Finally, I just want you to remind as doctors how we can prevent and what is our role in the society. When a patient comes to us with symptoms like flu, and it appears to be symptoms of HIV, and he tells that and agrees that he has unprotected sex, so we should start first antiretroviral therapy as soon as possible. And we are responsible to screen his sexual partner as soon as possible. And the next step is, if we notice that the person has HIV, it's our responsibility to screen his wife and the sexual partner, and it's our responsibility to screen the children too if they are affected with AIDS. And we are responsible of bringing awareness in the communities, in the villages, in the slums, and in the cities by encouraging the people to use preventive measures and to have only one sexual partner. We should encourage the patient if he is affected with AIDS. If he is in a condition of AIDS, we should encourage the patient for the future life and motivate the patient. And we should protect the information of the patient. It is our primary responsibility that we shouldn't share the information with all the people. That we should protect his, and we should share only with the people responsible with his life. And screening couples before marriage, it's very necessary nowadays. We should screen both the couples, both the men and women before the marriage, so we can prevent sexual transmission to the child. And we also as a public healthcare workers, preventing the HIV patients' withdrawal in the society. HIV patient is so affected with the society because he himself feels shamed and depressed of the society. So we should take care of his psychology too. And we should screen the neonate as soon as possible when his mother has HIV/AIDS. And we should also take care of personal care and bringing awareness of risk of prevention in the health workers, like in the nurses, doctors, and paramedics. We as doctors, we are responsible to bringing them awareness that how the HIV is spread in the hospitals. And we should take care of the like when a homosexual or when a sex worker approaches